A lot of people do go to you when they feel like they've kind of tried everything else, or they feel like they're just being kind of given these like cookie cutter protocols that everyone's getting. And that's really not what you do. Can you tell me a little bit about how you make sure you're customizing for each patient that you see?
Absolutely. The first step is come up with a list of what the possible issues are and see what we can do on our own before we start treatment to fix them. So for example, if you're 43, what do we want to do? We want to support your egg quality. If the sperm is not as good quality, we want to run some extra tests on the sperm before we even start IVF. We want to start supplements. We want to see a reproductive urologist. We want to check testosterone. We want to start Clomid for men. If there's adenomyosis, endometriosis, I don't want a patient learning that after 3 failed transfers, a couple miscarriages. We want to figure that out up front because it's going to be part of how we prep for transfer. We may not address endometriosis from the beginning because we might want to do IVF first. But if I were a patient, I wouldn't want to find out these things along the way in piecemeal. I would want to know all of the things up front. And then I design a plan for the patient that will hopefully address all the issues that we know that we have. And then I prepare for transfer. I just don't roll the dice. I present things to patients kind of like a menu, like these are all the things that you can do. And these are the reasons why you might want to choose these and why you might not want to choose a certain option as far as testing. And then we talk about transfer protocols, why I'm going to use what I'm going to use for them so that they don't have to rely on ChatGPT to explain it to them. My patients are super educated, and I have a sign in my office that says, don't panic, just email me. So it's like there's no question that is stupid, bothersome. There's also no picture that you can't send me. I get patients that send me lots of pictures. I saw this clock. Can I send it to you? I'm like, you don't need to ask, just send it to me. But yeah, that's my process. And I want to make sure that everyone's really excited for their transfer, that they feel like they're ready for it, that there's no other tests that they wish they had done, that their stress levels are low, they're sleeping well. Because if something doesn't work, I don't want anyone to ever say to me, I shouldn't have done the transfer. I knew that there was more testing that I should have done. I knew that this wasn't a good time because my husband and I are fighting. Those are the kinds of things that I want to avoid.